You know, back pain, pretty much everyone gets it at some point, right? It's one of the top reasons we go to the doctor. But what if I told you that sometimes hiding inside that familiar ache is a full-blown medical emergency, a condition where every single hour matters? That's what we're digging into today, a high-stakes race against time that starts with a symptom most of us just try to ignore.
So that's the big question, isn't it? We all get aches and pains. But how do you know when that nagging back pain crosses the line? When is it something you can't just walk off?
Well, the answer has a pretty serious name, cauda equina syndrome, or CES for short. This is a rare but truly devastating spinal emergency. It happens when that bundle of nerves right at the very bottom of your spinal cord gets squeezed, essentially cutting off the power to your entire lower body.
And to really get why this is so critical, think of these nerves, the cauda equina, as the main switchboard for your lower body. I mean, it controls everything, how you move your legs, what you can feel, even your bladder and bowel function. So when that switchboard gets compressed, well, the signals just stop, and the damage can be permanent. It's a really big deal.
Okay, so this is what you really need to pay attention to. These are the red flags, the symptoms that basically scream, hey, this is not your average back pain. We're talking about any changes in bladder or bowel control, new sexual dysfunction, or strange numbness in what's called the saddle area. Just think about the parts of your body that would touch a horse's saddle. If you have that numbness along with back or leg pain, that's a potential emergency.
Now here's what makes diagnosing CES so incredibly tricky. It doesn't always show up looking the same. Sometimes it's acute, bam, a sudden severe onset, maybe from a huge herniated disc. But other times it's insidious. It just kind of creeps up on you over weeks or even years, often because the spinal canal is slowly narrowing. You can see how that variation makes it so tough to spot, right?
So, with a condition this complex and time-sensitive, how do you make sure doctors and patients get it right? Well, in the UK, they've come up with a new battle plan, a smarter, more streamlined referral system.
So let's look at how things have changed. Before February 2023, the approach was basically a one-size-fits-all. Every single suspected case of CSS got sent straight to the emergency department. As you can imagine, that created some serious bottlenecks. Then, new national guidelines came out from a program called Getting It Right First Time, or GIRFT, and they completely changed the game by creating two different routes for patients.
And this is the new system. It's brilliant, really. It splits patients into two lanes. You've got the emergency path for anyone with active, worsening red flag symptoms. They still go straight to the hospital for a same-day MRI, no question. But then there's this new urgent path. This is for patients whose symptoms are more stable, maybe they've had them for a while. Instead of clogging up the ER, they get sent to a specialist musculoskeletal service within 2 weeks. It's just a much smarter way to use precious resources.
Okay, but here's the twist in the story. Having a great plan on paper is one thing, but does it actually work in the real world? Are the people on the front lines, the doctors and clinicians, even aware of it? A recent study decided to find out.
Now, when you first look at this data from a big survey of primary care clinicians, things look pretty good. A solid 88% said they were aware of some kind of guideline for cauda equina syndrome. So you're thinking, great, problem solved. But that's not the whole story.
Because this is the truly jaw-dropping finding when they were asked specifically about the new 2023 GIRFT guidelines. The numbers just fell off a cliff. Yeah, 74% of the specialist first contact practitioners knew about it, but get this, only 9% of general practitioners, the family doctors who are the first person most people see, were aware. 9%, that's less than 1 in 10. Just think about that gap.
And this gap in knowledge isn't just a medical issue. It has huge financial consequences. When diagnoses for CES are missed or delayed, it costs the UK's National Health Service over £18 million every single year in legal cases. The stakes here, both for patients and the system, could not be higher.
So what's the answer? How do we close this dangerous gap between the national plan and what's happening on the ground? Well, the research points to a really clear solution. It's all about translating those big national guidelines into simple, easy-to-use local pathways.
And the evidence is right here. Let's look at what happened when clinicians were using an old local pathway, one that hadn't been updated with the new GIRFT guidelines. Look where their urgent patients went. Almost 40% were still being sent to the emergency department.
That's the exact problem the new system was designed to fix.
But now, look at this. What a difference. When clinicians had an updated, new local pathway that reflected the new guidelines, the referrals totally flipped. A huge majority, 57%, were correctly sent to the MSK triage service. And ER referrals, they dropped all the way down to just 10%. I mean, that's the proof right there. Clear, updated, local plans work.
And it really all comes down to this. Just as the researchers themselves put it, the key to winning this race against time is turning that big national strategy into local, practical action. An up-to-date local pathway is the tool that gets best practice care into the hands of the clinicians on the front line, making sure patients get to the right place at the right time.
And that leaves us with a final, much bigger question, doesn't it? This whole story is about one very specific medical emergency, but the problem itself is universal. In healthcare, in tech, in any huge system, how do we make sure that brilliant, game-changing, even life-saving new ideas don't get lost in translation on their way to the people who need them the most?